Hi everyone, I'm Dr. Rahul Gupta and today we will discuss high blood pressure in young people. So there's an alarming increase in the number of patients having high blood pressure at a younger age. And what is more alarming is that by every year I am seeing a decline in the age at which the patient is having a high blood pressure. So the other day I saw a school going 10th standard kid, I would say I'm a kid only, that he came with high blood pressure. Now this was completely an unknown thing or a very rare thing where a young person would develop a high blood pressure, because high blood pressure is generally considered a problem of a old person or a elderly person. So we saw a shift from 60s to coming to 50s to 40s to 30s, and we are now seeing in 20s and in teenage people, so which is quite alarming. Now when we looked into the reasons are physical inactivity. The kids are not sleeping on time. They are sleeping, they are seeing, either they are busy in social media, they are watching video games or TVs or serials, and then they are not sleeping adequately. So if they sleep late and if they have to get up early in the morning, and this is happening with the working class also, that they have to wake up, so the amount of sleep which they get is much less. Then if you look at the eating habits, a lot of junkies everywhere you go, whether it is in the office canteen, even in schools and all, I have seen sometimes junk kind of food is served, and now it has become a norm. Whenever you are going outside, you are eating a lot of unhealthy food. So these are a lot of things which have started happening, and we see that the stress is also increased. So there is a pressure from the parents, there is pressure from the peers to perform, and in their studies, or if you look at the people who are young adults into their workplace, they have to perform, and they have to continue to strive. So all those things have made high blood pressure very common. Previously it was only secondary causes like defect in the kidneys, or some kind of birth defect like coarctation of aorta. So there are certain defects which are rare, and they were responsible for high blood pressure in young. But we are getting the same blood pressure which we used to get in older age in younger people, which is called as essential hypertension. That means lifestyle is the reason for that kind of change. So I would urge everybody that you should check your blood pressure even if you don't have any symptoms, because blood pressure is usually a silent killer. It is worldwide known as a silent killer, but the impact are grave over a period of long term, because if the BP remains high for longer time, there are a lot of things which can happen, especially in younger people, because they have to live a longer life. So I would say start physical activity, lose your weight if you are overweight, eat healthy diet most of the time, take less salt, lots of fruits and veggies, avoid a lot of animal products. You can have them, but avoid a lot of them. Quit addictions, smoking, alcohol, do meditation, yoga, pranayam, exercise, sleep well, and I think you can be well away from high blood pressure. And if you are in the initial stages, you can actually prevent yourself from taking the medication, and your BP will come back to normal. So these are certain things which I would suggest for every young person to do, check their blood pressure and follow a heart healthy lifestyle. Thank you.